Hello everyone, welcome back to UWorld's Next Gen NCLEX review. My name is Nicole here with another question drill set. Welcome in. So glad to have you guys. So glad to see you guys again. If you are new here and don't know how a question drill set works, well, welcome in. A question drill set works by I pull up a question right above me. I give you about 30 seconds to review the question, mull over the answer choices, and then I go over why the right answers are right and the wrong answers are wrong. You can drop your answers down in the chat. We have nurse moderators in the chat discussing with us as well. We have Nurse Samantha in the chat moderating for us. So if you have any questions or I go through some of the answer choices a little bit too quickly, you can ask her any of the questions that you guys may have. And then I also just like to talk to you guys in the chat and create a little community. In all, we just like to have a good review session for the NCLEX. Send this to all your friends, your nursing school classmates, anyone that you can to get on the same page so we can all pass our NCLEX on the very first try. So today's topic is pharmacology. So a lot of questions about medications, side effects, things that we're looking out for, different things when it comes to medication in the whole realm of things. So not specifically a certain class of medications today, just pharmacology in general. So without further ado, let's get started. The question states, the nurse is preparing to administer Alteplase to a client who is experiencing an ischemic stroke. Which of the following findings would require follow-up prior to administering the medication? Option 1, symptoms started 2 hours ago. Option 2, left total hip replacement 1 year ago. Option 3, blood pressure of 190 over 110. Or option 4, right-sided muscle weakness. Let me know what you guys think in the chat. Hello, everyone. Someone says, Otria says, my exams are next week and they're so nervous. You got this. Don't be nervous. You know it, and we are here to help you. Thanks for tuning in so you can get another study session in. Good answers coming in, slowly trickling in. Like I said before, we reached 100,000 followers on Facebook. If you could share, like, subscribe to all your nursing school friends, even people that are about to start their nursing school journey, whether they're in their first semester or taking their prerequisites, get them in the know. Let's start practicing these NCLEX style questions earlier because practice makes progress. So if you can send this to all your friends, that would be great. We would love to reach all these milestones on all of our favorite platforms, on all of your favorite platforms, whether it's Instagram, TikTok, Facebook, even YouTube. So share. Oh, congrats, Jody on Instagram just passed her exam last month. Congratulations to you. That's awesome. Welcome to the RN life. That's so good. Thanks for tuning back in. Keeping in the know. So the correct answer for this one is option 3, a blood pressure of 190 over 110. So let's go back to the question and see, let's try to break it down. So Alteplase. Alteplase is, or also known as TPA, which stands for tissue plasminogen activator. So this is a thrombolytic medication. So it prevents the thrombi from forming, or it goes in and it kind of burst those thrombus that have formed in those tiny vessels. Since it is a very strong medication, it can burst any tiny little blood clot no matter where it is in the body. So it has a very narrow therapeutic range. So it has a very strict guidelines when to administer, how to administer, just so we can be very safe and cautious so we don't create the contraindication, which would be bleeding effects. So we are paying very close attention with anything with TPA. So when we're teaching about it, we have teaching about the hemorrhage, the stroke for hemorrhage, hypertension, any recent surgeries. So any surgeries within the last 14 days wouldn't be considered a candidate for TPA. So that option 1, or not option 1, option 2, the total hip replacement 1 year ago, that is above the 14 days, so that is okay to have. Also option 1, the symptoms started 2 hours ago. This is okay. We try to get them within the 4.5 hour range. Anything more than that, it can cause hemorrhagic stroke or hemorrhaging. Other precautions that we should watch out for is that blood pressure. So blood pressure of 190 over 110, this could be excessively high. We do have a higher blood pressure parameter, usually around the 180 mark, but something in the 190, and especially with the diastolic of 110, is considered severe and extreme. And so we wouldn't want to give this medication because then it can cause further damage. I think that's all. Oh, and then option 4, the right-sided muscle weakness. This could be a symptom of the stroke itself. So that is okay to still have and still take with the TPA. But you guys did very good on that one. Way to start the ball rolling. Let's go to this one. The nurse is caring for a client with diabetes mellitus who is receiving insulin Lispro and insulin Glargine. Which of the following statements by the nurse would require follow-up? Option 1, insulin Glargine reduces your risk of developing diabetic ketoacidosis. Excuse me. Option 2, I will wait to administer your insulin Lispro until your meal tray arrives. Option 3, insulin Lispro dosing depends on the number of carbohydrates you will consume. Or option 4, I will check your capillary blood glucose level 1 hour after insulin Glargine administration. Let me know what you guys think in the chat. Which one would require follow-up? That's the key word there. So require follow-up also means we're looking for a wrong teaching, an incorrect teaching point. You got to pay attention very closely to how the wording in the question is. Love to see these answers trickle in. Good job, guys. Also, let me know, is there any other new NCLEX passers, or if you scheduled to take your NCLEX recently, I'd love to give you another shout out, whether it's wishing you good luck or congratulations. Let's get the chat going. Any other recent NCLEX passers or test takers? We have Jira on TikTok taking hers on Monday. Good luck to you. You're going to do awesome. Beans takes theirs in 9 days. Good luck to you, Beans. The Destroyer takes theirs in 2 days. Priya takes theirs next month. Khadijah takes theirs on Wednesday. So many. Jaden takes theirs tomorrow. Jamari takes theirs next month. Good luck to you guys. So many people taking theirs in the next couple of months and weeks. Judith's taking theirs in November. Petros just passed. Congratulations to you. Welcome to the RN life. We have people waiting for the ATT. Oh, that was the other thing. I also need to start adding ATT as one of the option choices because I feel like a lot of people are in that limbo of waiting for the ATT. So if you're waiting for the ATT, I'll send a good luck to you too. And a patience. Patience is a virtue. So drop those in the chat. Would love to have Nurse Samantha give you a little shout out in the chat. And I will move on to the correct answer, which is option 4. I will check your capillary blood glucose level 1 hour after insulin Glargine administration. So we're looking for incorrect teaching because it says require follow-up. So all 3 of these answer choices are correct teaching with insulin Lispro or insulin Glargine. But let's break those down. Insulin Lispro is a short-acting insulin, meaning that it's going to peak anywhere from 30 minutes to 3 hours-ish after administration. Insulin Glargine is a long-acting insulin, meaning it doesn't have a peak time. It just continuously works throughout after administration. So with that, option 4, I will check my capillary glucose level 1 hour after insulin Glargine. This is incorrect because insulin Glargine does not have that peak time, or it doesn't have that highest point where it will severely drop your blood sugar. It will just keep it steady. So 1 hour after administration of a long-acting insulin isn't going to do much for us in the assessment game. It would be helpful if we did it 1 hour after an insulin Lispro administration, but not insulin Glargine. So that is why it's incorrect. Options 1, 2, and 3 are correct teaching points. Option 1, insulin Glargine reduces your risk of developing diabetic ketoacidosis. This is correct. Again, that Glargine is that long-acting insulin, so it tries to keep your blood sugar down for a long period of time, which is good and prohibits that diabetic ketoacidosis. Option 2, I will wait to administer your insulin lispro until your meal tray arrives. Again, a correct teaching point because insulin lispro is short acting. So if we administer the lispro before the meal tray comes and they start eating, it can further drop their blood sugar into maybe a hypoglycemic event. That's something that we don't want to have. So you always wait till the meal tray arrives and they're actually eating to administer that short acting, so it has something to actually start acting on and it doesn't further drop them. And then option 3, insulin lispro dosing depends on the number of carbohydrates you will consume. Again, yes, this is a correct teaching point with that short-acting insulin. It's going to act on the carbohydrates and that blood sugar spike that is happening as you're eating or that meal that you're about to consume. So depending on what you're eating and that carbohydrate, that insulin lispro and that short-acting will cover that. So, but you guys did very, very good. Next question. The nurse is reviewing new medication prescriptions for a client who is receiving clopidogrel. The nurse should clarify the prescription for what? Option 1, metoprolol. Option 2, furosemide. Option 3, omeprazole. Or option 4, levothyroxine. Let me know what you guys think in the chat. We have Liz scheduled for October for her NCLEX. Sonia or Sana, also scheduled for October. Good luck to you guys. Love that. Someone asked, what time do you start the live stream? We start the live stream today on Thursday at 3 p.m. Central Time. But we go live seven times in 5 days of the week. I said it backwards, but yes, we go live multiple times a week. On Tuesday, we go live at noon Central Time with a lecture. On Wednesdays, we go live at 11 a.m. Central Time and 7 p.m. Central Time. It's like a trick question for me. Thursdays, we go live at 11 a.m., 3 p.m. Central Time. Friday, we go live at 7 p.m. And then Sunday, we also go live at 7 p.m. as well. So many times for you guys to tune in and get this extra help that you might need for your NCLEX. Drop those answers in the chat. If I went through that event schedule a little bit too quickly, you can always visit us at uworldnursing.com. We have the event schedule of what we're going over in the next couple of weeks, the specific topics. So if you want to make sure that you are getting maybe a notification, you can turn on your notification bell to tune in to next Wednesday's question drill because you need extra help on that. You can do that there, all at uworldnursing.com. Good job. Lots of good answers in the chat. Glad to see that. We are also hosting a really cool event called a Klexberg webinar, which is another free resource for you guys, which is another lecture that is going to be hosted on Monday with Nurse Samantha and Nurse Rebecca, and we're going over cardiology and select all that apply. I will have Nurse Samantha throw in the link to sign up for that. It is a free resource, but it is on Monday, and it's going to be a great lecture. A lot of fun content, a lot of meaty content that's going to help you guys get ready for your NCLEX. So lots of ways to get your studying in for the NCLEX. Okay, correct answer for this one is option 3, omeprazole. So let's go back to the question again. Clopidogrel. What is clopidogrel? Excuse me. This is an antiplatelet medication used to prevent the blood clots from clumping together and forming extra blood clots. This is used usually after an ischemic stroke or myocardial infarction to prevent, or sometimes even AFib, to prevent those blood clots that are forming from a pool of blood. So with this medication, this is what I would call a high priority medication, which means I would always want this medication to be working at all costs, because if we do form a blood clot, that can spiral into more problems. So we would not want to mix it with omeprazole. Omeprazole is a proton pump inhibitor, and it actually hinders the effect of clopidogrel. So if clopidogrel isn't working, and like I said, it's a high priority medication, we always want it to work. If it's not working, swelling, then we're right back to square one and we're having a problem of risk for getting a blood clot. So we never mix omeprazole and clopidogrel. Those are contraindicated. All the other options, options 1, 2, and 4, these medications are okay and safe to give because they don't have an effect on clopidogrel. So you actually most likely will see them given together or they have different effects. So totally fine. But you guys got that very easy. Next question. The nurse is caring for a client with oral candiditis who has a new prescription for Nystatin oral suspension. Which of the following actions should the nurse take? Select all that apply. Option 1, tell the client to wait 10 minutes after taking Nystatin to consume food or fluids. Excuse me. Option 2, monitor the client's oral mucous membranes for redness, swelling, and irritation. Option 3, remind the client to discontinue Nystatin once the client's symptoms subside. Option 4, shake the bottle of Nystatin thoroughly before dispensing the prescribed dose. Or option 5, instruct the client to swallow Nystatin after swishing the medication around the mouth. Let me know what you guys think in the chat. Oh, so good to see Karami on Instagram said UWorld helped her pass the NCLEX. Congratulations to you for passing the NCLEX, and thank you for using us and being a part of your NCLEX journey to get there. Good job, guys. Drop your answers down in the chat, and we're halfway through, so I can ask my favorite question of the day to get the chat going. Where are you guys tuning in from? I love to see how far UWorld reaches in the world, whether you're domestic or international, you're here in Texas, or you're somewhere on a beach where I want to be. I'm jealous. Let me know where you're tuning in from. First one I see is Minnesota, Kenya, Ghana, Florida, Austin, Texas. Someone's asking for the link for the webinar. We'll put that in the chat. Ghana, Minnesota, Canada, Texas, Seattle, California, Jamaica, Virginia, Bahamas. Yes, on the beach. Oh, I would join you. Mexico, Pennsylvania, Uganda, Oregon, Oklahoma, Zambia, England, Louisiana, Canada, St. Thomas Virgin Islands, Johannesburg, South Africa, Brownsville, Texas. You're at the tip of Texas, the bottom tip. Ohio, Turkey, Ethiopia, Alabama, Dallas, Texas. Couple Dallas. Hello, Dallas people. Welcome, neighbors. Nigeria, United Kingdom, Gambia, Brazil, Liberia, Wales, Washington, Seattle. Nigeria, Canada, Sandler. I've never heard of Sandler. Nebraska, Bangladesh, Bahamas, Sierra Leone, Waco, Denmark, Somalia. Lots of places all over. We have a lot of international people. Hello, international people. And hi, Miguel. Puerto Rico, Nigeria, Georgia. Thank you guys so much for tuning in wherever you are, however late it is, wherever you're watching. Thanks for doom scrolling and stumbling upon us. That is always good because you're getting educated and your parents would want you to be educated. So all good things. Okay, correct answer for this one is options 2, 4, and 5. So we're looking for correct teaching points and correct things to do with Nystatin oral suspension. So Nystatin is an antifungal medication used to treat that candiditis or that thrush of the mouth. So with this, we want to monitor the client's oral mucous membranes for redness, swelling, and irritation because it can be a side effect, but if it gets worse, that means that we probably need to switch the medication. So we want to monitor this because it should be medication should actually help. But if we're having increasing redness, swelling, and irritation, we need to monitor, let the provider know, possibly changing the medication. Option 4, shake the bottle of Nystatin thoroughly before dispensing the prescribed dose. This is true. It is a suspension, meaning that it kind of separates. So you need to shake it to get a good mixture of the medication. So then when it coats the mouth, the correct medication components are coated, distributed around your mouth correctly is the best way to put it. And then option 5, instruct the client to swallow nystatin after swishing the medication around. This is correct. It is an oral medication, or if it's an oral medication, it can get in the corners and the little peaks and nooks and crannies of your mouth. So swishing it really well in your mouth and actually trying to keep it coated in your mouth for as long as possible before swallowing, that is also another good teaching point for this medication, because you want it to really coat and get a good effect on that fungus that is in maybe those nooks and crannies of the mouth. Option 1 is incorrect, because 10 minutes is actually too short of time after taking nystatin or after eating. You actually want to wait a good 30 minutes before eating after taking this nystatin, because you want to make sure that really coats your mouth and it doesn't just wash away with all the food that you eat. So either take it 30 minutes after, or 30 minutes after eating or drinking, or just hold it in your mouth and hold your food until then. Option 3, remind the client to discontinue nystatin once the client's symptoms subside. This is incorrect teaching for pretty much any medication. You always take the medication completely until you're out, so it doesn't reinfect you later. Always, always, always finish your medication. But you guys did great. Question 5, the nurse is reviewing new medication prescriptions for a client at 29 weeks gestation who is experiencing preterm labor. The nurse should clarify the prescription for what? Option 1, magnesium sulfate. Option 2, betamethasone. Option 3, indomethacin. And option 4, doxycycline. You can tell I'm not an OB nurse because I don't know how to say these words correctly. But let me know what you guys think in the chats. Is the rationale. Oh yeah, you can put some rationales. I love to see the rationales as well. Good for you guys. Emmy said that she passed her NCLEX on the very first try using UWorld. Thanks for using UWorld and congratulations to you. That is awesome. That is what UWorld is destined to do. We're here to help you pass the NCLEX the very, very first time. Whether it's through our flashcards, creating your own study guide to make it personalized to you. We have so many fun, cool little tidbits within our subscription that I really, really, really encourage you guys to get a subscription for, so you can tailor your NCLEX experience for you. So that whether it's the flashcards, our mini lectures, our study guide plan, the question bank with over 2,000 questions, it has a lot of cool resources to make your NCLEX, your journey, personalized to you. So go to uworldnursing.com to check that out. We also have a free 7-day trial where you can get 50 free practice questions. So it's none of these questions that we go over on the live. It's really straight from our bank. So I encourage you guys to get on that as well. Someone was asking how long are the live sessions. They usually run 20 to 30 minutes depending on how many questions we have. Today we have 8, so it's probably going to be a little bit shorter. Good job, guys. Keep those answers coming. I'm loving the rationales that we have. Tola said tetracyclines are contraindicated due to teratogenic effects. Beautiful, beautiful. That was like the best answer rationale for why doxycycline is not prescribed for a client with who is preterm or in preterm labor. So this doxycycline is a teratogenic medication, meaning it cannot given at any point of the pregnancy because it can harm the fetus. So if this medication doxycycline were to get to the fetus, it can cause irregular bone development and of the teeth and of the long bones. So we don't want any disformed children out in the world. So let's just not give them medication while they're in labor or while they're pregnant. All the other options are medications that you actually do see with clients that are in either preterm labor or just in labor in general or in their pregnancy journey. Mag sulfate is indicated for preterm labor because it is a fetal neuroprotective. So it protects that brain of anything like maybe cerebral palsy. It's very neuroprotective, very good for them. Betamethasone, this is a steroid shot to help the fetus's lungs develop, usually given in 2 doses, but any is better than none if they are able to hold that preterm labor longer than 24 hours, because you usually do it once every 24 hours. And then indomethacin, that is an NSAID that prevents that prostaglandin production, which also helps relax the smooth muscles of the uterus, maybe slowing that preterm labor. And it's safe to give a preterm client. So you guys did very, very good. Good job, guys. Question 6. The nurse is caring for a client with bipolar 1 disorder who is receiving lithium. The nurse should recognize which of the following are risk factors for developing lithium toxicity. Select all that apply. Option 1, dehydration. Option 2, hyperkalemia. Option 3, hyponatremia. Option 4, hepatic cirrhosis. Or option 5, acute kidney injury. Let me know what you guys think in the chat. Excuse me. Good job, guys. And like I said earlier, we have a NCLEX webinar that is going to be held on Monday, which is going to be really, really good for you guys. It's going to cover STATA questions and cardiology questions. I will have Nurse Samantha throw in the link for that. It is free. You can subscribe and watch maybe during your lunch break or breakfast break or break in general to get some more free resources for your NCLEX studying journey. It is on Monday. Lots of good answer choices. Love that for you guys. Good job, good job. I love that y'all are really active in the chat today. Correct answer for this one is options 1, 3, and 5. So we're looking for those findings associated with lithium toxicity. So lithium is a mood stabilizer used to treat bipolar, but it also has that narrow therapeutic index. We've had a lot of medications that we've gone over today that have that narrow therapeutic index, which means we have to have a lot of monitoring so it doesn't create some adverse effects that could be potentially fatal or even worse complications. So with lithium toxicity, that's when we get out of the range and have too much lithium. This can cause some severe problems, but in order to get into lithium toxicity, that is usually driven by dehydration, hyponatremia, or low sodium or acute kidney injury. So all of the things, kind of think of the things that help filter that lithium out of the body. So our kidneys, if it's not filtering it out or we're not having enough hydration or fluids to get it out of our system and we're just building a whole bunch of lithium in our body, then it's going to lead to that toxicity. So dehydration and hyponatremia, so we're dry. And then acute kidney injury, which is that kidney not filtering it out in the first place. Those are all things that are going to lead to that lithium toxicity because it's not getting in our system or getting out of our system. So we need to teach them to drink a lot of water and have a normal sodium intake. Don't take too low sodium. So they're not going to be on a sodium restriction diet. They're just going to have a regular sodium diet. Early manifestation of lithium toxicity include the GI symptoms, so nausea, vomiting. But if it gets too severe, we can have some severe lethal dysrhythmias. And then you could have agitation, slurred speech, tremors, or even seizures. Options 2 and 5, these are not associated really with lithium toxicity at all. Hyperkalemia and hepatic cirrhosis don't have to deal with lithium at all. Question 7. The nurse has attended a staff education program about ketamine. Which of the following statements by the nurse would indicate a correct understanding of the problem? Select all that apply. Option 1, clients who are receiving ketamine may experience hallucination. Option 2, bradycardia and hypotension are common adverse effects of ketamine. Option 3, nursing care should be clustered for clients who are receiving ketamine. Option 4, ketamine can be used to treat clients with treatment-resistant depression. Or option 5, administering a selective serotonin reuptake inhibitor with ketamine can reduce adverse effects. Let me know what you guys think in the chat for this one. Excuse me. Also, let me get the chat going again. Let's talk about your nursing school. Rep your school if you are, or your nursing program. Tell me what nursing program you're a part of or what school you're representing. And let's do some fun shout outs. Let's get the chat going. It's slow down a little bit. I like it when it's going fast. College of DuPage, that's the first one I see. Ross College, University of Michigan, Florida State. Someone said just graduated, but graduated from where? The Philippines. UTA cohort. I went to UTA. Cool stuff. Mississippi State University. Harmony Healthcare Institute. Valencia College. Honduras. No, that's not Honduras. Hondros. LPN in Ohio. Someone is bridging from an LPN to an RN. You got it. Way to go. Way to come back. Herzing University. Congratulations for just graduating. Houston Community College. Another LVN program. University of Nairobi and University of Virgin Islands. Nice. Cameroon. Ethiopia Jimma University. Nursing college in Greece. That sounds amazing. And then there's Samantha just put our the website link to sign up and get that webinar that is on Monday. Okay, correct answers for this one is options 1, 3, and 4. So we're looking for correct teaching points when it comes to ketamine. Ketamine isn't really isn't really used as often anymore, but is given for multiple reasons, including pain management, depression management, and even sometimes sedation. So it kind of works as and like an opioid. So it mimics any opioid type of effect. So yes, that pain relief. But then if it's too much in our system, we can also have CNS depression like symptoms. So it has a high lipid soluble, and so it penetrates that blood-brain barrier very, very quickly, which also means it has that narrow therapeutic range. So you have to be very careful when giving this medication, which is also probably why it's not used as often. So option 1, clients who are receiving ketamine may experience hallucination. This is correct. Like it's that opioid type medication. It can give that opioid type symptoms. So too much of it can have that hallucination, the anxiety, and things like that. Option 3, nursing care should be clustered for clients who are receiving ketamine. This is true. You want to cluster the care as much as possible because you want to have a low stimulus with them, because any agitation or too much stimulus can cause that agitation, or it can cause that hallucination, which we do not want. And then option 4, ketamine can be used to treat clients with treatment-resistant depression. Again, this is just an indication for ketamine. It is not one of the top uses for ketamine, but it is one of the indications that can be used nowadays. Option 2 is incorrect. Bradycardia and hypotension are common adverse effects of ketamine. It's actually the opposite. You usually have tachycardia and hypertension with ketamine. And then option 5, administering a selective serotonin reuptake inhibitor, SSRI, I should have just said the easier word, with ketamine can reduce adverse effects. This is so close, but actually not correct, obviously. And I can see how this tripped up a lot of people. Yes, you can give those medications together, but it doesn't reduce the adverse effect. Benzodiazepine and ketamine reduce the adverse effect, but put those two together don't reduce the adverse effects. So close. You got to make sure to read the answer completely, fully, all the way through. Okay, question 7. The nurse is preparing to administer Phenytoin to a client with seizure disorder. The nurse should recognize that adverse effects of Phenytoin include option 1, hypertension, option 2, acute kidney injury, Option 3, deep venous thrombosis. Or option 4, central nervous system depression. Let me know what you guys think in the chat. Also, a reminder to visit us at uworldnursing.com because we have those fun free resources, whether it's your 7 free day trial or 7-day free trial, or you can sign up to get the question of the week where we send you a question directly to your email inbox so you can have the privacy of mulling over some of these harder questions by yourself. And then we also have our event calendar on that page. You have lots of fun, different clickable resources for you for your NCLEX journey. So visit us at uworldnursing.com, or also like, comment, and subscribe to us on your favorite nursing channel, whether it's Instagram, TikTok, YouTube. Many ways for you guys to get plugged in and stayed plugged in. So you can also tap that little bell in the corner to always get notified when we go live or we post new things. I posted a funny reel like yesterday. Reel? Is it a reel? Y'all know what I mean. I posted a funny video yesterday, so go like my video. Let's see. Good job, guys. Lots of correct answers in the chat. This one, correct answer is central nervous system depression. So, Phenytoin. This acts on the CNS, the central nervous system, and can cause CNS side effects as well, especially when the dose is excessive. Again, another medication with a narrow therapeutic index. If it gets too much or it builds up in our body, we can have nystagmus, which is that continuous eye flickering back and forth, which is sometimes common. Other manifestation include sedation, ataxia, which is that staggering gait, and that double vision as well. Option 1 is incorrect because Phenytoin actually causes hypotension because that CNS depressant act that it has on the body. Option 2 is incorrect. It doesn't really have any effect on the kidney. And then option 3, it does have effect on the platelets, but it actually causes bleeding. It increases your bleeding risk. So you would be at a risk for thrombocytopenia and hemorrhaging and bleeding, not a DVT, which is that clotting. But so close yet so far. Thank you guys so much for tuning in. I hope you guys learned something new, or hope you got better practice. You got some refresher on some of those medication names, especially those ones with narrow therapeutic ranges. If not, you could always tune and watch us again on YouTube. Is usually the easiest way you can find and search the specific topic that you guys want. But like I said before, you can always follow, like, subscribe on any of our social media channel. I hope you guys learned something. Thanks for tuning in, and I'll see you guys next week.